Do you frequently feel like your heart pains sometimes? Or maybe you get very sick after a small cold? While these might not seem related, for some people, it could be linked to something much deeper, like not having a spleen. Now wait, what does the spleen even do? Think of it like a security guard for your blood. It filters out bad bacteria and helps your immune system fight infections. If someone has had their spleen removed, maybe after an accident or surgery, they can develop something called Post-Splenectomy Immunodeficiency, also known as Asplenia. That means their body becomes weaker at fighting certain infections. It's like removing the security system from your house. Everything might look fine at first, but danger can sneak in much easier. Ever had a simple cough turn into pneumonia? For someone without a spleen, that kind of thing can happen faster and be much more dangerous. So what causes asplenia? It usually happens when the spleen is removed due to injury, disease, or surgery. For example, imagine a car accident where the abdomen gets hit hard, the spleen being delicate might rupture. Doctors might have to remove it to save the person's life. Other causes include medical conditions like sickle cell disease, where the spleen gets damaged over time and stops working even if it's still there. It's like a phone with a dead battery. It's present but not functioning. Some people are even born without a spleen, though that's rare. So whether it's gone due to trauma, disease, or birth, the result is the same: your body loses a key defender against bacteria, especially those wrapped in capsules like Streptococcus pneumoniae, which causes pneumonia and meningitis. Now, what does it actually feel like to have this condition? Most of the time you might feel normal until you get sick. And when you do, it hits hard and fast. Have you ever seen someone go from feeling a bit off to high fever and confusion in just a few hours? That's a red flag for asplenia. Common symptoms include sudden fever chills, fast heartbeat, and trouble breathing. Kids without spleens might seem to catch every bug at school, more sore throats, ear infections, or worse. Think about two friends, one with a spleen, one without both, get the same mosquito bite or cold. The one without the spleen might end up in the hospital, while the other just takes a few days off. That's because their body can't quickly stop bacteria in the blood. It's like having a slow antivirus on your computer. Threats spread before they're detected. How do doctors know if someone has this issue? First, they ask, have you ever had surgery on your abdomen, or were you born with any blood disorders? If yes, they might suspect asplenia. A simple blood test can show unusual red blood cell shapes, which hint at spleen problems. Imaging like ultrasound or CT scan can confirm if the spleen is missing or not working. Once diagnosed, treatment isn't about fixing the spleen, it's about protecting the person. That means vaccines like your annual flu shot, but also ones for pneumonia, meningitis, and flu. They're like updating your security software regularly. If you get sick, doctors act fast, often prescribing antibiotics right away, even before test results. It's better to be safe than sorry. Some people even carry a spleen card or wear medical alert bracelets that say, I have no spleen, give antibiotics fast. Imagine being on vacation and getting a fever. That card could save your life. You can't prevent the spleen from being removed during an emergency, but you can prevent the infections that follow. Vaccines are the main shield. After spleen removal, doctors recommend vaccines within 2 weeks. Boosters are needed every few years, just like checking your smoke detector batteries. Also, taking daily antibiotics, especially in kids, can help. Avoid ticks and mosquitoes. They carry infections like babesiosis that are extra risky. Think of it like sunscreen. You don't wait until you're sunburned. You put it on before going outside. Travelers without spleens should carry emergency antibiotics and know the nearest hospital. Simple habits like cooking meat well and washing hands become life-saving. Would you skip your seatbelt because you're just going around the block? No, same logic, small risks add up. Recent research is making life safer for people without spleens. Scientists are testing longer-lasting vaccines and smarter antibiotic plans so people don't develop resistance. One cool advanced doctors are looking at spleen like filters small devices that might one day do the spleen's job in the blood. Imagine a tiny robot cleaning your bloodstream. Also, studies show that mRNA vaccine tech, like in COVID shots, might be used to target more bacteria faster. Another breakthrough, earlier screening for those with blood disorders, so they get vaccines before the spleen fails. Telemedicine apps now remind patients about boosters or symptoms like a smartwatch, alerting you to drink water, but for health protection. Researchers are even studying gut bacteria's role in immunity. Maybe one day probiotics could help boost defenses in Asplenia. It's exciting we're moving from just protection to actually replacing lost function.